This video is for database members who are looking for help with Mycoplasma infections. I'm going to show you where to go. Start with the menus, click on Diseases and Disorders, then go to Bacterial Infections menu. It will be listed under M. There's so many, this is how they're organized. And we see Mycobacterial infections, and if you are dealing with something like Mycoplasma pneumonia, walking pneumonia, here you go. Videos that explain it, treatment, prevention, complications, articles and studies. Underneath, you'll see Mycoplasma treatment. This provides details on the top natural agents for treating Mycoplasma infections. Scrolling down, we see herbal agents with antimicrobial activity. There's the herb, the mechanism of action, the types of mycoplasma that are targeted, and any notes and cautions. Then we have key supplements. Serapeptase dissolves biofilms and non-living tissue, enhancing antibiotic penetration. Vitamin C for immune support, titrate to bowel tolerance, and then of course lifestyle and supportive measures, cautions. Next we have a section on the top agents for different types of Mycoplasma infection. For example, Mycoplasma pneumonia for the respiratory system. The agents, the actions, the cautions for infections of the urogenital system with the specific species of Mycoplasma that are involved. Species involved in neurological and systemic infections, especially chronic co-infections such as occur in Lyme disease, and for practitioners or patients of practitioners using Chinese medicine. Traditional Chinese medicine patterns are also included. So here's a mapping of key natural agents used for Mycoplasma infections according to TCM. For respiratory, Mullen, and the TCM pattern here is lung yin deficiency and wind heat. The TCM function is it nourishes lung yin, clears heat, and soothes cough. So there are a couple of different frameworks here for practitioners to use. And we go through the same thing with TCM view of urogenital mycoplasma, neurological, and then Western pharmacological analogs are also included. So for respiratory agents, Mullen, it's demulcent, expectorant, anti-inflammatory. And here are the Western analogs, the Western drugs that are used. And Mullen is an analog for these. Same thing with urogenital agents and the neurological agents. Now here is a very useful Mycoplasma protocol selector quiz. The purpose is to match symptoms and constitution to appropriate herbal and supplement protocols for Mycoplasma infection. You have questions like which symptom profile best describes your current experience. This is a decision tree. So for example, if the answer is A, a persistent dry cough, chest tightness, and a mild fever, you would go down under the correct answer to A and see that you're likely dealing with respiratory Mycoplasma. The suggested agents are listed here, the mechanism involved as well. Then the next question is going to be what best describes your constitution. And if balanced and resilient, you just need general support. Suggested agents are green tea extract, probiotics, and vitamin C. Another question, are you currently taking antibiotics or pharmaceuticals? And just follow the decision tree down for further guidance there. Finally, we reach number 4, which support strategy appeals the most to you? And finally, when to think about Mycoplasma as a Lyme co-infection. Now on the left-hand side of the screen, here are some of the agents that have been shown to be useful in Mycoplasma treatment. So by all means, come over here and click on them, learn about them, how they work, what the dosages are, if there are any further cautions that you need to be aware of. So this will help you get started on resolving Mycoplasma issues. Thank you for watching, and if you have questions about something that you're looking for in the herbal database, I will be happy to walk you through it. Just let me know in the comments.